Hi, my name is Dr. Alan Cross. I'm a board-certified chiropractic physician. I've been in practice in Tucson since 1995. I've got some really important information to share with you today if you suffer from some kind of chronic condition. What makes me different from every other doctor you've seen? We treat patients metabolically and neurologically. I'm here to tell you that no stone is left unturned to determine the exact cause of your condition. We use metabolic treatments based on specific lab panels. By using specific blood tests such as a thyroid panel, a complete metabolic panel or CMP, a lipid panel, and a CBC or complete blood chemistry. We can assess your thyroid, adrenal glands, liver, kidneys, red and white blood cells, and gut function with the above lab test. All can be affected with chronic health conditions. By addressing any problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you to heal faster. The CMP also allows us to check your blood glucose levels since glucose and oxygen are needed by the brain to function properly. We also check for sensitivity. This test determines if you have a sensitivity to gluten, which includes wheat, rye, oats, and barley, milk, eggs, yeast, and soy. If you're sensitive to any of these food groups, it's making your condition worse. If you have the following symptoms, you could be suffering from sensitivity to gluten, soy, milk, eggs, and/or yeast. Chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers or sores, or if you vomit often. We also check for an adrenal stress index. We can further test your adrenal glands with a test called an adrenal stress index. This is a salivary test much like a DNA test. Your adrenal glands are your stress organs, meaning that they react to stress. If you have been or currently are under stress, this test is a must. If you suffer from insomnia or blood sugar issues, this test will measure your cortisol levels. When your body's cortisol levels are abnormal, you will suffer from insomnia and/or problems with your blood sugar. Cortisol levels can be corrected via specific nutritional protocols. We also check your immune panels. As you know, an autoimmune disease is where your immune system attacks a particular area of the body, like your nervous system, your joints, connective tissue, your thyroid, etc. So we test for specific antibodies to determine if you suffer from an autoimmune condition. The immune panels include a lymphocyte subpopulation, cytokine levels, natural killer cell activity. The immune panels give me an in-depth picture as to what is exactly happening with your immune system. If you are suffering from an autoimmune disorder, it trumps everything and it must be the first thing to be addressed. Your immune system has two parts, Th1 and Th2. We need to find out which part is working and which one is not working. Only then can we successfully treat your specific condition. Examples of autoimmune diseases are rheumatoid arthritis, lupus, Hashimoto's, Graves' disease, multiple sclerosis, pernicious anemia, and others. We also do an H. pylori check to run a test for your H. pylori bacteria to determine if any problems are related to gut function. We also check your intestinal permeability. We use this to determine if you suffer from leaky gut syndrome. Leaky gut syndrome describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or infection. It can lead to increased permeability of the gut wall to toxins, microbes, undigested food, waste, or larger than normal macromolecules. It has been proposed that these substances affect the body directly, while others postulate an immune reaction to these substances. We also check your neurotransmitters. We test for decreased brain neurotransmitters. Neurotransmitters are vital for proper brain function. Decreased neurotransmitters can cause increased pain. We also check hormone panels. We can check hormone panels to determine if you're suffering from low testosterone in males or low estrogen or progesterone levels in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. We also check for inflammation. We may need to test for inflammation in your system by testing homocysteine levels and C-reactive protein levels. Many patients suffering from chronic health conditions suffer from inflammatory processes. We also use glutathione in our treatment of all autoimmune conditions. Glutathione is the mother lode of antioxidants. Glutathione cannot be taken orally in pill form as the body will not absorb it. We've seen miraculous changes in our patient population as a result of our specific glutathione protocols. Glutathione is especially helpful with autoimmune diseases. And how do we treat your condition? First, we use oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. We also use brain-based therapy, including vibration therapy, spinal decompression therapy, and other therapies to get the brain firing the way that it should. So ask yourself the following questions. How has your condition affected your job, relationships, finances, family, or other activities? What does it cost you in time, money, happiness, and sleep? And where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? What is it worth to you if we could improve your condition? We can show you how to finally end your peripheral neuropathy, numbness, tingling in the hands, numbness, tingling in the feet, balance disorders, vertigo. So here's what to do next. If you're really serious about the possibility that there could be an alternative treatment for you or your loved one, call our office at 520-797-4177 and tell me that you're interested in setting up a consultation or case review. We do give you 2 free visits to see if we can help you, and honestly, I don't take on every case, because if I don't feel I can truly help you, I'm not going to take on your case. So give us a call, 520-797-4177, and let's get you in for an evaluation, your 2 free visits, and see if we can help you out with your condition. Thanks a lot and have a great day.